It's 12 o'clock, and like I say, we've got a packed agenda over the next hour and a half. So I'm going to get started with just a couple of housekeeping bits. So firstly, you are all really welcome to today's launch, the official launch of the National PPI Ignite Network. It's fantastic to see 152 people on the call, and even more coming in through the waiting room. So it's brilliant that there's so many people on the call today. You're all very welcome. Just a couple of housekeeping bits. So firstly, I mentioned already, but for those of you who are just joining, this launch is being recorded. You've probably gotten a prompt on your screen, but if not, just to let you know, we are recording at the moment. In terms of microphones, you'll see that you've all been placed on mute as you entered the meeting, and this will remain the case for the rest of the session. So for those of you who are speaking, you will be granted permission to take yourself off mute before you start speaking. So just to make sure that you take yourself off mute. In terms of the chat, you can see the chat is active. Please feel free to pop any comments, suggestions, questions in the chat, and we'll be here to monitor throughout the session. And cameras, it's great to see so many people with your cameras on, and I think it allows us to connect visually and put faces to names. So if you can, please keep your cameras on for the session. If not, we completely understand. It's not always possible. So without further ado, I'm going to hand you over now to Professor Dinneen, who is the lead for the National PPI Ignite Network.
Thanks, Emmy, and welcome everybody to this official launch of our PPI Ignite Network. As Emmy said, I'm Dinneen. I'm a diabetes doctor based in Galway, and I have the privilege and the honor of helping lead this really exciting PPI Ignite Network. So what do we mean by PPI is a question that we are asked not infrequently. For us, PPI in research means research undertaken in meaningful partnership with the people who are most likely to be affected by the research results. So I think it's helpful just at the beginning of this session and this conference or this meeting to clarify that. I think the key words are meaningful and partnership. So our PPI Ignite network, you'll see on the screen in a moment, is a coming together of 7 universities and 10 national partners. So Edel Murphy, whom you'll be hearing from later in the session, and myself, along with Casey Donaghy, are based in the National Programme Office. And we work collaboratively with our 7 university partners: DCU, NUI Galway, University of Limerick, Trinity College Dublin, RCSI, UCC, and UCD. Each of us try to champion and build capacity within our individual universities around meaningful public and patient involvement. Each of us also, and I'll illustrate it for in the case of UCC, have local partners. So in the case of UCC, you can see the local partners that they work with listed here. Some research institutes, some All Ireland institutes, and so on. So as well as this local partnership, we also have in this network 10 national partners. And again, you'll be hearing from some of these in the course of the next hour and a half. But you can see that some are higher education institutions, some are charities, some are research organizations. But we're really excited to be partnering with each other across the universities, with our local and national partners, to really deliver on the public and patient involvement in research agenda in Ireland. So at this point, I would like to welcome everyone, but especially Minister Anne Rabbitte, who has joined us this morning during her busy schedule. Minister Rabbitte is Minister for Disabilities, and we're really honoured to have her officially launch our network. Minister Rabbitte.
Thank you very much there, Sean. And I am delighted to join you today to mark a significant milestone for research in Ireland, for public, for patients and for carers. The PPI Ignite Network is an important national initiative to involve the public, patient and carers in key decision making. And this includes areas such as what topics get addressed in research studies, how the research is done, and how it is disseminated for maximum impact in society. Public and patient involvement at all stages of research process is so important for the future health and well-being of our citizens. The PPI Ignite Network will provide leadership for PPI in research in Ireland, driving excellence and inspiring innovation by embedding a culture of meaningful involvement and participation of public and patients in research across our universities and our communities. At its simplest, public and patient involvement is about research being carried out with and by the people who are the focus of the research, rather than to, for, or about them. The funding of 5 million made available by the Health Research Board, the Irish Research Council, and the 7 universities at the centre of the network is a very significant commitment to PPI. With the national office at NUI Galway and the programme offices at 7 participating universities, a network of partners locally, nationally and internationally, and an expanding cohort of committed PPI contributors, the potential for this network to make a difference is enormous. And it is encouraging that the network plans to expand its research, as there are many more who are interested in the shared learning and knowledge exchange facilitated by the network. The network's focus of meaningful partnership on improving the quality of involvement is particularly welcome. A research culture that is inclusive, patient-focused, collaborative and respectful of diverse voices is the end goal, and everyone here today can play a part in this journey. Today's launch is an important milestone for more transparent involvement of public and patient in shaping future health research in Ireland. A challenging but exciting road lies ahead. I wish all involved in the network well, and I encourage all researchers to embark on their own PPI journey, to seek out and work with people with relevant lived experiences to optimise the relevance and impact of research and enhance transparency and public trust. Nothing about us without us resonates strongly with me, and I particularly welcome the emphasis across the network on including historically marginalised groups in co-designing research, for example, people living with a disability and people from ethnic minorities. Involving people who have not had a voice previously can help shape a different and healthier future for so many in the coming decades. The PPI Ignite Network really is an investment in future health for all in this country. Thank you again for inviting me to the launch, the PPI Network, and I wish you all the best of luck in the years ahead on this fantastic initiative. Thank you.
Thanks very much, Minister Rabbitte, for your time and for your words of encouragement. We really appreciate it. If we were not in a virtual world, I guess that we'd have cut the tape or we'd have broken the champagne bottle or whatever. But we're launched, and that's something to celebrate. Thanks very much, Minister, for your time. Really appreciate it.
You're welcome.
So next up, I would like to introduce Wendy Costello. Wendy is a PPI contributor who really will introduce herself and share her hopes for what the PPI Ignite Network can achieve. Wendy.
Thank you so much, Sean and Adele, for inviting me to participate on this momentous day. So I'm Wendy Costello. I'm mum to 2 girls, one who has juvenile arthritis. I run a charity called ICAN, the Irish Children's Arthritis Network, and we support, advocate and raise awareness of paediatric rheumatic conditions. And I'm really delighted to follow Anne. I've met Anne on a number of occasions. She's not just a minister I admire, she's also extremely passionate about her work, and it's so easy to chat to and approach. So thank you for that lovely start, Anne. PPI in research is something I've become really passionate about. So today's launch is a very exciting milestone for us in Ireland. One of the many reasons I'm passionate about PPI in research is because of the people I've met on my journey so far. PPI doesn't magically happen for anyone. It's about building trust, networking, pushing yourself out there, asking questions, and this goes for both researchers and PPI contributors. Really pushing yourself outside your comfort zone. We're moving to a very exciting phase in PPI in Ireland. Individually, the PPI Ignite teams are doing some amazing work, and I have seen this firsthand because I've worked closely with many of them in UCD, DCU, UL, NUIG, and a special mention to the National Children's Research Centre. We're also moving into a new phase with the new Children's Hospital on the horizon. PPI Ignite Network Ireland brings together so many great minds, and I'm so excited to see this. It's time to use this investment wisely as a PPI team. Listen to the people who have tread this path for the last few years. Really support our research facilities who really don't know where to start with PPI. Thank you to everyone who's reached out to me personally over the last few years, sitting down together to discuss how you can incorporate PPI into your work will make your research stronger and more accessible to our patients, carers and public, who really view research as a black hole at the moment. Every day is a learning day for us all. It's another new day to move PPI a little further. Yes, some countries are a little ahead of us, but we are really gathering such pace, and today's launch will propel us even further. With people like Sean and Adele, Martha, Emma Doris, Veronica Lambert, Mandy Daly, Kay Curtin, and Isabella Bray, just to name a few of the amazing people I've worked with. I'm really excited about the next 5 years. I see internationally what is happening and how PPI is a main priority in research. I've worked with some great teams on small and large projects, but what remains at the heart of really good PPI is listening to one another, respecting one another, willing to think outside the box to really own PPI in your project. I may not always be the right fit for your research, but I damn well know a network of amazing contributors who would be. I see so many amazing people willing to be there on their day off, in the evenings, weekends, our unsung heroes. We have a WhatsApp chat with my IPOSI graduates, and every day I'm in awe of the work they do, fitting it in around their day. Like me, lots of them would like opportunities to make it more permanent, and this is something that we need to investigate and probe more about. And another passion of mine is involving young people in research. And I know this is something that needs significant funding. And I've spoken at length with Isabella, Emma and Veronica about this, and I hope we can take a huge step forward in the next 5 years. I'm the carer, but my daughter is the patient, and her voice needs to be captured. I've had a window seat to her juvenile arthritis, but I've not actually been in her shoes. For me, involving patients and siblings in research is so exciting and really the way forward. I love how passionate they are when they're asked what they think are the priorities or how they view their disease. So let's work on making this happen. So to finish off, I want to raise our coffee mugs to PPI Ignite Network. Let's all get behind this amazing network now in Ireland and support it in any way we can. And together we are stronger.
Thanks very much, Wendy. When we were preparing for today and for the official launch, and when we had a dry run to make sure that the technology and everything was working, I felt then, and I feel now, that we could actually stop at this point after that incredible contribution from Wendy, and just, you know, I think it says it all. But we have, just to signpost what's ahead, we have some we have some conversations that we would like to share with you. a couple of panel discussions that I will moderate, and then a couple of conversations that we hope will reflect the breadth and the depth of the network and what we're about. And like Wendy, I do think we have a wonderful opportunity here in Ireland to get this right, whatever that means. You know, we have an opportunity, I think, to really work together and deliver on this PPI agenda. So first up is a panel, and I'd like to invite my colleagues, Dr. Avril Kennan, Dr. Jon Salsberg, and Professor Thilo Kroll to join us for this panel discussion. Avril is CEO of Health Research Charities Ireland, which is one of the 10 national partners that I referred to earlier that are part of the network. Jon leads the PPI Ignite Network at UL, University of Limerick, and Thilo is the lead for PPI Ignite at UCD. So Avril, Jon, and Thilo, thanks for joining us, and you're very welcome. I have just a question maybe to begin with. Avril, I know from conversations that you and I have had that you've been on this journey, for this PPI in Ireland journey for a while, and that PPI was the focus of the very early activities of HRCI. What changes have you seen in terms of PPI in research, Avril, over the past few years?
Thanks, Jon. Yeah, so many changes, which makes today all the more exciting. So I first heard about this PPI notion in 2014, and it really spoke to me at the time. I worked for a patient organization, and I realized that this was a way that we could make research more meaningful and more relevant to the patient community that we represented. So I set about going to learn more about PPI and how to do it. But of course, at that point, there was no go-to place in Ireland for more information. So what I ultimately did is I spoke to a number of experts in the UK, and I recently found the notes from my very first conversation with a woman called Philippa Yields. And it was fascinating to read back over them. And what I can see from my notes is that Philippa gave me really practical advice. Then she gave me a little word of warning towards the end, and she said, you might find some resistance, and some researchers feel that it's a threat to the control they have over their own research. Some feel that they won't be able to speak openly in a room where there are patients present, and some feel that patients just simply won't be able to contribute valuably. And I don't think I took it that seriously at the time. I was probably a bit naive about that, but she was exactly right. When I started to go out and pitch this idea, I did get resistance, not across the board. Some people were very open to it immediately, but I did experience those things that she talked about. And there's no question that let's call it PPI hesitancy, still exists, but we're really getting there. And the last thing that the last bit of advice she gave to me was that if you get it right, it'll become part of usual business. And we've been on that journey together in Ireland for the last number of years of becoming part of usual business. So my organization ran the first ever Irish Health Research Forum event on the topic of PPI. And I hope that started a conversation, but the real momentum, of course, came with the PPI Ignites. And that kickstarted things in the universities. We were working with the research charities in parallel. We have 31 charities now involved in a shared learning group for PPI, and they're doing incredible things. And others are working with individual patients. And today is really the culmination of all that, and huge progress has been made.
Brilliant. Yeah, thanks. And Avril, just very briefly, I know you're involved in the in delivering PPI training within the network. Do you want to maybe just comment briefly on that aspect of our work?
Yeah, the training bit is really important, because at the end of the day, you're bringing two groups together, scientists working in a very rigid environment, patients who are bringing their very personal selves to it, and it's terrifying all around. So the training, the orientation aspects are really important. What the network is doing is really taking a look at what exists out there, bringing it together, ensuring we don't duplicate, and then looking at where the gaps are so that we can use our collective knowledge to create what needs to happen to support more PPI.
Brilliant. Yeah, and to be a network. Yeah, fantastic. Thanks, Avril. Jon, if I could, I know that, you know, in addition to leading the Ignite network at UL, you and our colleagues in UCC are also leading the network's focus on embedding PPI in education, undergraduate and postgraduate education. Can you tell us a bit more about your plans there, Jon, and what's happening?
Yeah, thanks, Sean. I'd be very happy to. So I think the important is, like Avril just said, our goal is to make this the normal way of doing business, is that PPI should be a special type of research or something with a specialized skill, but this is the base way that everyone approaches creating the evidence and the research and the knowledge that we need to improve the health of individuals and populations. And as we all said, what we mean by that is meaningful involvement of patients, members of the public, carers, anyone who is impacted or is going to benefit from what's coming out of the research process. So along with Emmy, who you heard from, and Patricia Kearney, and my partner, our project manager, Una McInerney here at the University of Limerick, we're leading an initiative which is complementing what Avril and that group is doing to further capacity for PPI. And our focus is on really being able to normalize the way that students are trained, both as researchers, as clinical researchers, as clinical scholars, and even as clinicians, to be able to involve meaningfully patients, carers, other members of the public in what they're doing. So that's our overall goal. And in accomplishing this, we're really trying to start from the basics, developing the principles of, you know, of what it means to integrate these things into teaching, how we're going to do that, what the learning outcomes are going to be that we hope that all graduates are going to come out with. And then with that, create modules, courses, programs as necessary, and also be able to integrate PPI components into existing modules, courses, programs all across the country and everywhere, and really be a resource, not just for all Ireland, but also, you know, anywhere else in the world, as we see ourselves as really being leaders in this and having an opportunity to lead the way and do this right and do this meaningfully, learn from other places that have maybe approached it and, you know, and done great things, but also missed the boat a little bit. And what can we do that's really appropriate for us and the specific context in Ireland, but at the same time being leaders to be able to export what we're doing for the rest of the world.
Brilliant.
So yeah, that's really our overall goal.
Thanks, Jon. And just the chat actually got there before me, but there are people already asking, you know, about opportunities for, you know, PPI training. Are any PPI modules, you know, available? What are the plans? We heard from Avril on the training side. What about on the kind of you know, module side and undergraduate and postgraduate opportunities?
So there certainly are some things that are available now. I know we offer some things at UL, and with the ECTS transfer credit system, people can register at different universities and have it come on so they can take it wherever there are. There are other things taking place at other universities as well. We will hopefully be able to make all of those available on the Common Share Network website when that is ready to launch. But over the next couple years, we are going to be you know, invested in this, as I said, this concerted effort in developing new things. So there are a smattering of things that are available right now for credit. There are things that are available sort of in a CPD way, not for credit, if you needed some quick stuff to get on with as we're developing. But I guess within the next couple of years, a lot more options are going to become available. Yeah. But the ones that are available now, hopefully, we will get listed on the PPI network website as soon as possible.
Thanks, Jon. That's really helpful. And yeah, I'm seeing similar responses from Edel and Michael Foley as well on the chat, directing people to the website and other opportunities to avail of training. Just finally in this panel, Thilo, thanks for joining us. Thilo, just equality, diversity and inclusion underpin all involvement activities. How will the network embrace the ethos of EDI across its own activities? How are we going to champion equality, diversity, and inclusion in your opinion, Thilo?
Yeah, thank you very much, Sean. It's a pleasure to be here today and to see such a great turnout. And as Minister Rabbitte also referred to, that one of the strength and perhaps difference of this network compared to other PPI initiatives is its emphasis on seldom heard voices as well. And what's a typical observation is that actually in many PPI initiatives, researchers tend to engage actually with the ones who are easiest to reach, to talk to, have similar educational academic experiences, and people who are less visible, who are rarely heard, who cannot communicate in the same way as the researchers or use a different language or have a different background are often not part of advising research teams or collaborating with research teams. So this is something that is very close to our hearts. So we need to ensure that actually everyone's voice or experience is reflected. Now, this is a challenge to us. This is not something for which a cookbook or a magic bullet would exist, but it's a learning experience, and we're learning from each other, and we're learning, I guess, from reaching out and finding ways and initiatives to reach those population groups who are, traditionally haven't been involved. And we heard of some groups already that were alluded to: people with disabilities, people who may have homelessness experiences, people who are from ethnic or linguistic minorities. And those are just some experiences that we're really concerned about reflecting as part of our network. And Wendy Costello mentioned the word comfort zone. So this is something that we really all probably have to address, that we really get out of our comfort zone, out of our habitual ways of doing things, and really finding new innovative ways of engaging with these partners around the country and beyond. So what we're doing as part of the PPI Ignite Network is to develop and implement a strategy around equality, diversity, inclusion. And this is a rolling strategy, I should say. I mean, it has been developed systematically over time through workshops, through engagement processes, and we had several draft documents along the way that have been continuously refined. But what we have now, and the strategy will be soon available from the National Network site as well, is work in progress. And I think we probably should look at that as a learning document. It explicitly lays out 4 pillars or 4 elements, that we want to take forward. The first one, that all of us have an expressive commitment to EDI principles. So that means we all are in the business together of ensuring that equality, diversity, inclusion is happening. We also need to model it. We need to ensure that in our governance, in our practices that we're engaging with, we have that diversity. We have different ways of engaging, and that's again sort of a learning process. And we also need to ensure that our training and educational elements are accessible, inclusive, and inviting really everyone from all areas of our population. And then finally, I think probably the most important one that I find for us is the willingness to learn and to improve and to share this learning with each other. So as I said, we don't have that cookbook, we don't have that magic bullet, but we can develop this together further.
Thanks very much, Thilo, for those that really thought-provoking and kind of rich description of our EDI ambition, and thanks for leading out on that for the network. So I'm going to hand back at this point to Emmy Racine in UCC, and Emmy will introduce the next portion of the program. Thanks to my colleagues Avril, Jon and Thilo for that panel discussion. Emmy.
Thanks very much, Sean. So we're now on to our next segment, as Sean mentioned, where we really get to see PPI in action. And we're joined by Mei Lin Yap, who is a PPI Ambassador Liaison Officer. She's been involved with a number of researchers on a number of different research projects over the past few years. And Mei Lin is joined by Professor Mary McCarron in conversation. And Mary McCarron is the Director of the Trinity Centre for Ageing and Intellectual Disability. And she leads the PPI Ignite Network at Trinity College Dublin. So over to you, Mei Lin and Professor Mary McCarron.
Much. I think I'm unmuted. So thank you for that, Emma. And it's a great day indeed, and wonderful event that we are launching finally, the PPI network. And thank you so much to Sean indeed and to Minister Rabbitte for being here with us to share today and to launch this very important initiative and the leadership, I think, of various groups in this. So I'm going to talk to Mei Lin Yap. Mei Lin, hopefully Mei Lin is here. Just can't see Mei Lin at the moment, but I'm sure she is here. Excellent, Mei Lin. Great, good to see you. And I suppose at the Trinity Centre and as part of IDS Tilda, we have been involved with PPI for a very long time, long before we ever called it PPI. And Mei Lin Yap has been somebody who has been working indeed very closely with us. So Mei Lin, great to have you here with us today.
Yeah, delighted.
Yeah, just tell the group a little bit about, how you got involved initially with this work at IDS Tilda and TCID.
Well, I'll bring you back to the very, very beginning of when I first started. So when I first started, I got involved in a project, and I have starred in a documentary with IDS Tilda called Aging with Pride. So it's a documentary based on the findings of 10 years of research by IDS Tilda, led by Professor Mary McCarron. So the documentary Aging with Pride was launched in 2018.
Yeah, great, Mei Lin. And what did it mean to you to be involved in the creation of that documentary?
Wow, that's a big question. For me, I loved every part of making that documentary. I've learned lots of things about aging in Ireland. And the study, I just think personally that I think we are incredible bunch of people.
Fantastic, and I know we were so privileged, Mei Lin, to have you to go out to people with intellectual disability and involve them. And I think that was just so great to have you do that, and hopefully people can view that. And then obviously another part of work, Mei Lin, that you're involved in was the National Dementia Seminar, which was really a big catalyst in helping to drive now a national memory clinic for people with Down syndrome. And why did you think that having a memory clinic for people with Down syndrome was important? And talk a little bit about brain health.
I think that brain health is so important every day, and it's good to exercise the brain. I think it's about keeping your brain active all of the time, if possible. And to me, with having this memory clinic, would utilize the tools in helping people like myself in the future.
Yeah, I think that is so important, and it's great to have you being the person that's out there selling the message to other people, Mei Lin. I think that is just so important. And I know, Mei Lin, that you now are the Ambassador Liaison Officer, and that's a new role that you have. So you started off, I think, as a student in the university, and then as a postgraduate, and then as a volunteer. And now you're in this new role. And tell me a little bit about, and tell everybody here a little bit about your new role and why it's important.
Well, I just want to just say that delighted to be here today. As you just said, Mary, I started off as a Trinity student, a graduate, then I became a volunteer with Ideas Tilda, and now employed in Trinity College Dublin, the most prestigious university in Ireland. And I just think that now I became the Ambassador Liaison Officer, and I have to tell you, it has been amazing. And this is one of the highlights of having my role, having my own staff card. It means the world.
Fantastic, Mei Lin. We are so pleased. And I know somebody else spoke about earlier on this morning about, Wendy spoke about, having people in employed positions. And I think we are moving to that. And I think that is absolutely fantastic. And in that role now, Mei Lin, I know you're involved in setting up a PPI panel for the centre, and you're involved in supporting other researchers. So I know you had a researcher recently, Myra, to prepare for research. So how do you do that?
Well, I have a bunch of questions that that myself and Michael Foley come up with, and I propose those questions to the researchers, asking about their projects and what they are doing and how they are doing it, why are they doing it, and just helping them with finding the right solutions to help people with disabilities.
Excellent. And I think that is the key thing, that you're helping them to find the right solutions, which is really the core of meaningful involvement in PPI. I think that is fantastic. And I know one event that you're currently working on is a commemorative event for people who are deceased. And you just might want to talk a little bit about that before we finish up.
Well, the commemorative event is that over the last 10 years, we had about, I'm not sure the exact figure, that have passed on within Ideas Tilda study, that we've decided to create an event to remember those who have died within the study. And I'm delighted to be part of that committee, because I think it's important as a person like myself who has a disability to bring my own expertise to something like this.
Yeah, absolutely. And I dearly recall, Mei Lin, the first time I mentioned it to you, getting a lengthy email with all of the things that was important for us to consider as we're planning this event. And I do want to say that your contribution now to how that event is shaped up is really going. So if you were to finish up, Mei Lin, and say, why do you think it's really important for people like yourself with a disability to become involved?
The real reason is, I think it's about for people to take a walk in our shoes, in people with disabilities' shoes, and have a look at the challenges that people with disabilities face on a daily basis. I think for me, that's really important to do that. I also think sometimes that people with disabilities don't understand what we're trying to say. And I think that barrier should be broken down just a bit more with helping people like myself to understand what all this is all about.
Yeah, excellent. And I really look forward, Mei Lin, to your future work now as you develop the PPI panel for TCID and your work in leading and shaping that panel. I just want to thank you very much, Mei Lin. I think you have made an outstanding and fantastic contribution to our work at Trinity, and no doubt now to the National PPI Network. So I really want to thank you for joining us in conversation today. And I'm going to hand back now to Emma.
Wow, thank you, Mary and Mei Lin. What a fantastic conversation. I know we're all on mute, but I'm sure if we were together in a room, we would have heard a pin drop there. We can see it coming in on the chat and people reacting just so positively to what you had to say. So thank you very much for that. We're moving on now. We're going to have a look at PPI in PhD research. And we're joined by Lorna Kerin, who's the Programme Manager of the PPI Ignite Network at the Royal College of Surgeons of Ireland. And she's joining us in conversation with James Larkin, who is a PhD student, currently completing the Sphere PhD training programme, which is funded by the Health Research Board. So over to you, Lorna and James.
Thank you, Emmy, and good afternoon, everybody. And Mei Lin, I have to say that was just so important for us all to hear your experience and how empowering and how much value you've created so far. I would take issue with your statement, though, that Trinity is the most prestigious university in Ireland. I think there was a couple of people who were shaking their heads. I'd say Michael Foley put you up to that, did he? So my name is Lorna Kerin. I'm the PPI manager in RCSI University of Medical and Health Sciences, and we're just down the road from Trinity, up on Grafton Street. So the shopping is better, Mei Lin, if you come up our route as well. So I'm really delighted to be here to talk to one of our PhD students who's a champion of PPI. James, can you hear me okay?
I can indeed, Lorna. Can you hear me?
Fantastic. Your mic is a little bit low, James. You might just do something with the volume there.
Sure.
So just a couple of comments, if I could, before inviting James to come in on the conversation. I'm really struck by this is truly a gathering of champions, and it's a gathering of parent champions who are in a caregiver role, and I'm mindful of Wendy's comment there about the unsung heroes, and just to really say, you know, the unsung heroes are indeed the foundation of PPI. So to thank all of those who are here, and also Mei Lin and people with lived experience are the very reason that we do our work. But importantly, the glue that holds all of that together and that empowers change to happen are researchers. And of course, there's older champions here like Thilo and Sean and Mary. I hope you don't mind me calling you elder or older, but there's also, it's really important that we develop the capacity of our younger champions. And so, James, we're all really interested to sincerely hear your perspective as a younger researcher. So I'm going to kick off, James, by saying that although our CSI is a new lead site for PPI Ignite, there has been some champions around for some time, including your own supervisor, Professor Susan Smith. So you might tell the community gathered here a little bit about how your PhD came about due to Susan.
Sure, yeah. So before starting my PhD 3 years ago, Professor Susan Smith went and met with a PPI panel in NUIG to discuss multimorbidity, which is living with 2 or more chronic conditions. And when she was there, people were bringing up issues around the costs of accessing care, particularly when you have, you know, several chronic conditions, and how this can be unmanageable. And based on that, she developed the idea for my PhD, which was looking at how much it costs to access care in Ireland for people with multimorbidity. So then we went on. She got funding for that PhD, and me, along with 3 other PhD candidates, Bridget, Aisling, and Louise, set up a panel of about 10 people living with multimorbidity, and we've been working with them for the last 3 years.
Fantastic. So, James, it really sounds like it was a patient-identified issue that really stimulated your whole PhD topic, which is looking on what is life like and the economic cost of living with several disabilities or several illnesses. So that's fantastic. And also because Anne Cody is here, it's really important to say it's the HRB who are funding your PhD, and indeed that of your exactly. Fellow students. Excellent, great. And James, a lot of people have already asked in the chat, what about training? What about supports? What about workshops? On your own PhD journey, what kind of training or supports have you found helpful?
Sure. So I found some of the conferences at the very start was great for getting your mind in the right headspace for PPI. So, you know, there's the conference, the annual conference in Galway, there was one in UCD, and then there were workshops in places like DCU and Galway. And on top of that, there's loads of pragmatic resources out there, like from the Involved Network, and there are some developing now in Ireland as well.
Okay, fantastic. So, and I know Adele, who's now the National Ignite manager, was involved, and Derek Stewart, who's here today, and a number of other contributors. Fantastic, super. And another question I have for you is around the cycle of research. I know there's a lot of people on the call here today who are researchers, but there's some people who aren't necessarily aware of that there's stages in the research cycle. So we come up with a research topic or a theme, we come up with a question, then we design it, and then we do the research, and then we evaluate the findings, and then we communicate the findings out. In terms of steps, PPI steps that are really important for researchers to think about along those different stages, what would you say from your experience?
Sure. Well, from my experience, I'd say be ambitious throughout the research cycle in terms of involving members of the public or patients. And then there's kind of hidden steps, I suppose, that are outside the research cycle. Like one of the biggest for us was actually getting the panel up and running. Contacting various organizations, using networks, creating new networks to find people who could provide constructive input on some of our research. And then after that, it's about creating a collegiate environment in order to get the best from the group and in order to make the most of their time and our time.
Okay, fantastic. So it sounds like as a first step, establishing that PPI panel is really important. And I know we've heard from Avril in HRCI earlier, and Derek Mitchell from IPOSI is also here, and they offer great support to researchers in identifying appropriate patient charities. So we just have a minute left, and I suppose my final question is around as a doctoral student, you're expected to create new knowledge through your PhD. Do you feel, or is your observation or has your evaluation shown that PPI has helped you create new knowledge? Has there been new learning through engaging in PPI?
Yeah, definitely on several levels. So on a fundamental level, it's changed our perspective on how research should be conducted, the importance of having members of the public and patients involved at all levels of the research cycle. And that's created new knowledge by improving our research and changing the perspectives of our research. And then finally, we've actually conducted an evaluation of our PPI. So we're hoping to publish that and hopefully inform PhD students in the future as to how they can best incorporate PPI into their PhDs or maybe even other research.
Fantastic. And I think actually one of the team is going to pop into the chat a paper on incorporating PPI in the design of PhD doctoral programs. So that'll be very interesting. And James, there was also an important learning around language, wasn't there, and multimorbidity?
There was indeed. So from the outset, multimorbidity is the word that's used, but we find that some of the people who were members of our panel, they weren't a big fan of the term multimorbidity, that they found it a bit alien and maybe a bit negative. And I found that just a brilliant encapsulation of some of the benefits of incorporating patients in the public. It can completely change some of the most fundamental aspects of what you're doing and what you're researching.
Fantastic. And the final wrap-up question, which we probably already know the answer to, but would you recommend that early investigator researchers would focus in on PPI in their PhDs? I
certainly would. It changes the perspective and practices of researchers from an early stage and allows involvement of patients in the public, which is the right thing to do, and improves the quality of people's research massively.
Super, wonderful. Well, wishing you the very best of luck. I know we're all looking forward to reading your thesis and the PPI related publications. And cheers, Sean, Lorna. I'll hand back over to you. Thanks, James.
Cheers.
Thanks, Lorna. Thanks, James. Really interesting to listen in on those conversations. Thanks, Mary. And special thanks to Mei Lin for that powerful account of your own experience of working as part of the IDS Tilde team. So really, I don't think we could do a better job at demonstrating, what it's all about. And even with the constraints of the virtual world, it still came across just so powerfully. So I'm going to just take you through another panel discussion now, and I'm going to invite my colleagues, Mark Robinson, Peter Browne and Patricia Kearney to join me shortly. So the first, when we put the program together, the first panel that we wanted to reflect the network at work. The first panel we thought was around practice and principles of the network. So getting down to forming those partnerships, you know, training opportunities for students in research and principles, especially around EDI. This second panel we have entitled Innovation and Expansion. So we're really keen to try and reflect you know, the journey that we're on and our ambition around bringing people with us on the journey. And so in that regard, I'm joined by Dr. Mark Robinson from Maynooth University, Peter Browne from the Irish Research Council, who along with the HRB are co-funding the network, and Professor Patricia Kearney from UCC. Mark, if I could start with you, why is Maynooth interested in being involved in the PPI Ignite Network?
Hi there, Sean. So I guess Maynooth University has a number of researchers who have been very active in the area of involved research for a number of years, right across the breadth of the university. So whether it's kind of integrating design-led frameworks into engaged research, or creating kind of technologies for assisting healthy aging and people living in the community, or whether it's experiential learning for undergraduate and postgraduate education. But a lot of this involved research has been occurring in silos. And so probably the biggest benefits that we have had in Maynooth University, but by becoming a national partner, is it really allows all these researchers from across the university, from across the institution, to come together with a clear focus. And really we see this access to the community of learning within the network as really the biggest benefit of being part of the network. And using this to kind of leverage and really build our institutional capacity. We have lots of experience, but it's translating that into capacity at an institutional level to allow other people people who are less experienced within our university, within our institute, to participate and get involved.
Yes. Thanks, Mark, and hopefully the network. You know, I think it is a two-way street, and you know, we're hopefully going to help Maynooth, and already I think Maynooth is helping us to kind of get our head around the whole issue of expansion and what does it mean. I know you're involved in that stream or that strand of our work. What does it mean to be part of the network? So thank you for championing that, you know, locally and nationally. If I could turn now just to Peter Browne from the Irish Research Council. Peter, thank you for giving us the opportunity to host this network and to form this network. How does the IRC view the PPI Ignite Network and its role in supporting health and social care research in Ireland?
Thanks, Sean. And just first of all, just to congratulate the network on the launch today, and we're really pleased to be partnering with the HRB on this important initiative, and the energy and the enthusiasm in the virtual room is really palpable. I mean, in terms of our role in this, I mean, it's very much core to the IRC mandate to cultivate collaboration between researchers and the wider set of societal stakeholders. And it's already reflected in many of our programs, and not least our new Foundation Civic Society initiative, which and the carers groups and other community groups around health and older people are very much key partners in that strand, and also our enterprise schemes and indeed our societal challenge-based program Coalesce. So you know, this is very much a logical partnership for us, which speaks to our core mandate. And we're very pleased to be supporting the second phase of PPI in partnership with the HRB, and also I think the strength of the partnership has also been reflected in our rapid response partnership during COVID-19, and I think, you know, I think in the IRC we're always trying to cultivate initiatives which will then have a wider ripple effect and perhaps international impact. And I think there's a real opportunity for Ireland to lead internationally in this area, and perhaps use this second phase of PPI Ignite as a means of catalysing perhaps European or Horizon Europe funding for a further phase, and in doing so to strategically cooperate on a wider basis again. So I think the opportunities are huge in this area. I suppose I'm also struck by the wider lessons for the research and innovation system from PPI Ignite. The link between this and I don't want to use too much jargon, I've been warned against that, but the link between this and responsible research and innovation, and also something which the IRC have been working on for a number of years, the sex and gender dimension in research content and ensuring that research speaks to that. And I see very strong links between PPI Ignite and these other areas.
Great. Okay, thank you very much for that, Peter. Next, if I could, just Patricia Kearney has joined us from UCC. And Trish, UCC was not part of the initial Ignite programme of work, but you have a strong PPI base in Cork on which you're now building. What's the view from UCC on the network?
Thanks, Sean. So yeah, very similar, I suppose, in a way to Mark, in that aware that there was a lot of activity across the university, but delighted, I suppose, to have the opportunity to bring it together through the network, and also been delighted with how generous the existing partners have been with their knowledge and experience, and really helped us frame PPI Ignite at UCC. I suppose I was very mindful, I work in the health area, but that, and I know I saw in the comment there, somebody commenting that language matters. And I suppose one of the things is, we're familiar with the term patient and public involvement, but the type of work that's being done, engaging with people and giving voice, that's called different things by different disciplines. And I suppose what we've found in UCC in developing the network is that it's been an opportunity to bring together like-minded people from across the 4 colleges, from different research centres, so that we can work together and break down those silos that I know Mark was talking about there. And similar to what Peter touched on, there are all sorts of intersectionalities, I suppose, there when we start to think about the idea of nothing about us without us, and that it does touch on other areas such as research integrity, such as gender, and so we're really excited in UCC to be part of the network. Brilliant.
Okay. Thank you very much, Trish, and thanks also to Peter and Mark for that discussion. So next, I'm going to hand over and introduce Adele Murphy, who is the National Programme Office Programme Manager for the network. And Adele, right from the get-go, we had questions on the chat, and lots of people wondering about where they can find out more about the network, how they can get involved, and so on. I'll leave you maybe to answer some of those questions, Adele. Sorry, Adele, I think you're still on mute there.
Sorry. I'm delighted to have, thanks, Sean. I'm delighted to have the opportunity to answer some of the questions that come up in the chat in terms of how people can connect in with us. So we've talked already about the different universities that are involved, and in each of the universities there's a programme office with a programme manager who are very much developing and expanding and supporting researchers locally and PPI partners and contributors in the local area. And we've also the national partners have a focus in different ways on PPI. So there's a real network of expertise developing and building up. And then we've talked also about our local partners. So this just gives you a flavour of the breadth of local partners across the different universities. And these are also building their expertise, and the network is very much around sharing knowledge and exchanging experiences as we go through which will be facilitated through the network. So how can we help? Well, a lot of what we're going to do is going to be centred around our website, which is being launched today. ppinetwork.ie. So I might just give you a quick flavour of the ways in which we hope that this will become a port of first call to begin to check out information that you're looking for. So there are a lot of different PPI events happening around the country. And it's about letting people know what's going on. So we have an events section on our website where PPI events will be published in advance, and it'll be possible to come and see what's happening with links to where you can register. We have a section on our work, and we thought where we would begin initially was by sharing with you some of the case studies of very varied and very different PPI initiatives that have been happening across the country currently and in recent years. So we have a number of case studies in there, and we've continued to curate and add to these, giving a breadth and a flavour of the variety of ways in which involvement is being undertaken, and with an emphasis too on challenges and solutions to challenges. Resources, everybody's looking for resources. And again, in our resources section, we've included already some resources, and we will build on these as we go forward. Again, a variety of beginning resources if you're getting started, a lot of seminars that are being recorded and are very rich source of information. And finally, we have a Get Involved section on our website. So as a starting point, we invite you all to register with us. We'll have regular newsletters and information flow to those who are interested in keeping in touch with what we're doing. The focus areas that, a selection of our focus areas, we've already heard from Avril and Jon about PPI training and embedding it in education. We're looking across the network at some of the obstacles that make it difficult for involvement. And our aim is to recommend change and help to make this easier and implement change where we can. We will focus on making PPI top class, quality improvement. Ones to watch, things that we're working on. We'll have a PPI opportunities online portal on this online hub, which will allow researchers share opportunities and allow PPI contributors and partners to connect up. Focus on network expansion has been discussed. We're going to have an annual PPI festival, first one in autumn 2022, which will be events all over the country, celebrating and expounding on the activities that are going on. And finally, we're going to set up a public advisory panel. We've done initial planning for this, which will bring the public voice very much to the centre of our network activities. So what are the actions for you? Register with us, follow us on Twitter for those of you who are on Twitter. Join our shared learning opportunities. But in the events calendar, you will find a number of online opportunities in particular at the moment, where everybody is welcome to join and learn, and there'll be information about training events also. And above all, connect with each other. We have 200 and something people here today. So it is about connecting in with the people who are interested in promoting and developing and improving on PPI. So this is a good time to look ahead at, good time to look ahead at the next period in the lifetime of the network. And I'm happy at this stage to introduce Derek Stewart, PPI advocate from the UK, and Dr. Anna Cody from the Health Research Board. So over to you, Derek.
Hello, Anne. How are you?
I'm good. I'm good. Great to see you again, Derek.
Well, it's strange, isn't it? Almost 2 years ago since you invited me to the HRB offices. And I was just thrilled by what you were doing at HRB and thrilled with this initiative. And I don't think we would have imagined we would be where we are now. I said you were educators. You'd send these students out to go and prepare and do some work, find things out. What's the report card looking like?
I am absolutely delighted with it, I must say. And as you say, a few years back, I wouldn't quite have imagined just the breadth of engagement, the depth of engagement across the country. And I mean, just seeing, 250 people in this launch here today, that demonstrates the level of interest that there is, and the level of buzz that this is creating. So, that is absolutely fabulous. That's exactly what we wanted. We wanted to mainstream PPI and get as many people involved with doing as good PPI as they possibly can, whilst recognizing that we're all still learning, and let's not be the perfect, be the enemy of the good. Sometimes you have to go with the good and test it out and improve it from there, and don't theorize forever.
In your recent blog on the HRB website, you talk about this as having a conviction that it enhances the quality of research and subsequently patient care. Do you want to just expand on that a little bit?
Yeah, I mean, the HRB spends public money, taxpayers' money. So we have an obligation to spend that money in the best way possible to get the most results out of it. And one of the things I think is incredibly important is the first selection of what do you fund, and having a voice of those people who are affected by an issue, be it it can be an illness, or it can be prevention of illness, or indeed how the healthcare system works, or there are so many health-related aspects. Having the voice of those people included in the setting of the research question, I think, is incredibly important, because that will steer you into those areas, those questions that really need to be tackled. And I put it onto the chat a few minutes ago saying that it really strengthens the case for funding a particular application. It's no guarantee, but it certainly helps. And then feasibility is such a big issue. And in particular, any research that includes recruiting participants that are in some way contributing to the research, it's always the problem, it's always the bugbear that people have wonderful recruitment targets and it doesn't happen. And what better way than to ask the people, the kind of people that you would like to contribute, to work with you on making this feasible, on making this interesting, and making it doable for the right participants.
You also take it all the way through. You have a line which says it's about sharing results and making sure it's applied, which I thought was really, really exciting.
Well, that's the final piece of the jigsaw, isn't it? The most wonderful piece of research, if it isn't shared, doesn't do much good. And from our perspective, if something isn't shared, we've lost the value of that investment. Again, sharing is, there are many different ways in which research is shared. And yes, academic papers absolutely are important. But what's also critically important is to talk to those who have decision-making roles in policy and in practice. And if you want to change practice anywhere, again, you need to involve those who have an opportunity to make change into the research as early as possible, so that they can bring in their concerns, their possible limitations or opportunities, and shape the form of the research and make it useful. And obviously having stories told about the impact is one of the best ways of disseminating and creating an impression and a lasting memory of a piece of research.
It's always a pleasure to talk to you, Anne. I've just hit the 1 minute warning, so you're going to have to be quick on the last thing. what advice or thoughts would you give to this as a network, and what would you like to see them do?
It's a really important step to move from the individual PPI Ignite Awards to this network, and that was always part of the vision, and I'm delighted that we're here now. It's that common voice. It's that not just informally working together as they have done all along, but broadening it out and being able to tackle things with one voice, and so to take on the bigger questions as well, where you can not quite set standards, but kind of come to an agreement that this is the way you want to handle things nationally. I think it's really that there are huge opportunities in that, and we'll all be massively positively surprised by all the wonderful things coming out of this.
Pass on my thanks and regards to people at HRB, and I look forward to visiting soon. Thank you very much. And over to Martha, I think.
Hi, Derek. Thanks a million, Derek and Anne. It's really, I must say, it is very exciting. I can see from the chat, people are kind of enthused by it. And I think we are all looking forward to moving forward on that journey together. So now we're moving on to the final part of our launch event, where we were keen to have some kind of interaction. And as many of you are aware, the SFI are coordinating the Creating Our Future initiative, asking the public to contribute ideas to shape the future national research agenda. Here, we're going to ask you now about some things that matter for PPI and for the network. And next week, this day next week on the 9th of November, the HRB are running an event which will help you to how to shape a research question for submission to Creating Our Future. So let's see what inspiration we garner here today. Over to you, Martha.
Fantastic. Thanks very much, Edel. So hello, everyone. My name is Martha Killalay, and I'm the Programme Manager for the PPI Ignite Network at NUI Galway. And I'm delighted to be joined by my colleague, Una McInerney, who is the Programme Manager for the PPI Ignite Network at University of Limerick. We've heard from a whole host of fantastic speakers this morning, and this is now where we'd like to get interactive and gather your input. We would really like your input and perspectives into our work here at the PPI Ignite Network. So I welcome some of you who feel comfortable to do so to go to your web browser and go to www.menti.com. So you can see on the Zoom screen there, we are welcoming you to go to www.menti.com. For those of you who would prefer to stay on Zoom, that's no problem. You'll be able to give your perspectives via the chat function. So fantastic. I can see some of you have joined us on menti.com and you've been prompted to enter a code. So that code is 56946094. So for those of you who have joined us on www.menti.com, the code is 56946094. And for those of you who feel more comfortable to stay on Zoom, you'll be able to give your input via the chat function. So I now welcome my colleague Casey to share the Mentimeter for us here. You should be able to see the first question. Fantastic, there's things already in. And over to Una now.
Thanks, Martha. So our first question today is, what excites you most about the PPI Ignite Network? And I can see that a lot of people have already started inputting their responses, and that's great. So either via menti.com or in the chat, whichever you prefer, what excites you most about the PPI Ignite Network? I'm just seeing collaboration, inclusion, learning, training, patient voice, perspectives. A lot of different responses coming through there. Diversity, inclusion, partnership. That's great, everyone. Impact, shared knowledge, appreciation, creativity. Okay, brilliant. That's great. Thanks a lot. So still coming in. I'll just give it a couple of seconds more. We have participation, putting patients first, respect. Okay, that's great, everybody. Thanks very much. We're going to move on to the next question now. So if you've gone to menti.com, you should automatically move to question 2. And if not, you might see a pop-up message saying that the presenter has moved to the next slide, and you can click go to slide. And I can see that the instructions are just there in the chat as well. So I'll hand back to Martha for the next question.
Brilliant. So our second question this afternoon is, how do we grow and develop PPI? So if you'd like to input some thoughts into Menti or into the chat function here on Zoom, and we can see a lot of comments came in for question 1 on the chat, they'll all be taken into account. So thanks very much. So we have things like make it normal, opportunities, collaboration. There seems to be a real sense of collaboration over today's event and thoughts coming in via these questions. Mutually beneficial, absolutely. Increased awareness. Hopefully today's event and future events like this will continue to increase awareness so we can grow and develop PPI. Making sure the language of PPI is distilled and accessible for everyone, absolutely. And as I see so many comments coming in here on Menti, I know it's quite difficult to read them, but we will create a zoomed in version, hopefully, and be able to share it with you. Communication. A place to access knowledge, 100% to that website that's being released today. Great comment in here in the chat. Inclusion building, confidence, no jargon. Absolutely. So I can see you've all inputted so much there. So we may move along to the next question now. So for those of you who are on Menti, you might need to click go to next slide to move along to the last question. For those of you on the chat, you can just input them via the chat. So over to you, Una.
And our final question then is, what is your take-home message today? So again, either in menti.com or in the chat. It's not scary, it's not hard. Great. Keep an open mind and be willing to learn and change. Together is better. Everyone has a voice. Good PPI makes things better. Optimism, get going, give a voice. Inclusivity is key, and treat each other as equals. So we have a lot done and loads more to do, to coin that phrase. Momentum is developing, and now is a great time to start and learn together. PPI improves results for the right people. Let's go. Okay. So we might have come to the end of our inputs unless anybody has any last bits that they want to add. A couple of last bits coming in. Stakeholder engagement for a future together. Be part of this great PPI movement in Ireland, and it's worth it. Ethic of care approach will really help realize meaningful PPI. Meaningful impact and partnership. Open mind, get involved. Total inclusivity. So still more coming through. It's about making it normal, demystifying, making it the norm, making it normal. Key message there. Why did it take us so long? Try it. Partnerships are essential. Okay, so I think we might have nearly come to a stop there. Thanks very much, everybody. That finishes our questions for today. I'm going to hand you over to Sean for the final part of the agenda.
Thanks, Una, and thanks for a very interactive session there with a huge amount of activity. Hard to keep up with the word clouds and the posts on Menti and the chat at the same time, but clearly there's a huge appetite for what we're promoting through the PPI Ignite Network. So before wrapping up, I'm delighted to let you know that we've been joined during the meeting by the president of NUI Galway, Ciarán O'Hogarty, and I'm just going to call on Ciarán maybe to speak. We've already referenced the Health Research Board. We've heard from Anna. We've referenced the IRC, our other major funder, and we've heard from Peter Browne. It's important, I think, for us as a network to acknowledge that a significant part of the funding that has enabled this network to happen is coming from the 7 universities who have all who all see value in this for us as a research community. So if I could call on Uachtaráin O'Hogarty to maybe say a few words.
Thanks, Sean. Great to see Derek again. Thank you for joining us, and all of those who've joined the network. I think this is a great occasion for us to launch the broader PPI Ignite Network, and I'm very pleased to be here tonight on us show. And it's mainly because, and colleagues will be used to me talking about our values of NUI Galway, but in a way these values were informed by our colleagues in PPI Ignite in that, and the work being done in public patient involvement in Galway, values of respect, openness, excellence and sustainability. And very often I talk about these, but I was reflecting today that these in fact came from this community. So not only does this launch reflect those values, but in fact have shaped them. To me, it's an attitude of mind, a frame of mind, that you start off with respect to the patient, to the public good, and to involving patients in research from the very beginning. So very often traditionally research goes about its business and then finds ways to apply the research, where in this case we're starting from the very beginning with those that should have agency in the first place, and that we're designing the research from the very beginning with patients in mind, with patients and the public involved. And I think that really transforms the research process, not only in having better outcomes, but also in having better process and a better sense of respect and a more profound sense of respect for those for whom that research is in the first place, the patient in the first place, and the public good as well. And it also reflects today, I think, the value of openness of the university, in that we're sharing the network and opening up the network to a much broader set of participants. And again, that's a frame of mind that very often universities are seen as competitive, and that one thing we're doing we shouldn't share with others. And I think the frame of mind here is exactly right, that this is something that is good for all, and that we're willing therefore to open the doors and to share our expertise across the network, not only in NUI Galway, but in all the other institutions, supported by the Health Research Board, supported by IRC, and as we've said, could shape SFI's agenda as well in the context of research futures. Excellence is here, in the sense of here we have high standards, and very often again we sometimes define high standards as being something which is remote or something which is vague or abstract. Here excellence is very much based on the interaction with the patient, and we know that when you're ill and in need of support, one of the most important things for you is to have a sense of your own empowerment, your sense of your own agency, your sense that you have, that your sense of self-worth is not lost. And I think very important, profound part of this research and the frame of mind, the open frame of mind that's here, is that excellence is defined by the patient and by public engagement, and that it is not something abstract, that it's something that the standards we set ourselves are those that are deserved by patients, and that respect the patient and public engagement from the beginning. and not as something that's a byproduct at the end. And I think that's something that's really important in the network as well. And finally, that sense of sustainability, and very often, and particularly this week with all going on in Glasgow, we see sustainability as something that's quite rightly to do with the environment and climate, but it's also about sustaining each other, sustaining traditions of research, sustaining humanity, and in its most profound context, in when people are ill, when people need support, when people are patients engaged in research, that this is a very profound calling, and sustaining each other through difficult times, as we all have, and as this research is engaged with. I think that is the most important sustenance we can provide. And so I'm particularly pleased for all those reasons to say to you today, congratulations, Cogordicus Levidig. As in Irish that translates as we celebrate together, and I think the sense of participation here recognizes that, but also to say thank you. The work you're doing is really important, is very profound, and the engagement of the public and patients from the beginning, and that focus, that frame of mind, that respect for humanity and our fellow human beings, I think is at the heart of all the work that's going on here. So on behalf of NUI Galway, all the partner institutions in the network, all the research funders who are supporting it, can I just say to you all, thank you, Gur Mahagav, really important work, and thank you all very much for it.
Gur Mahagav, Ciarán, thank you very much for those words of encouragement, and thank you for making the time to join us on the launch event today. So I think we're drawing to a close. I have to say that I am completely inspired by this event. I have felt fortunate to be involved in the Ignite movement from its early days. I have a sense that we're doing something that is meaningful to people, that we're touching a chord, within the health system, within the health research system, within society, and I hope it continues. It's a privilege for me to be involved in this effort, and I think just the energy on the chat and the energy in this virtual room that we've been in for an hour and a half now is really strong. I'm not going to make the age-old mistake of thanking people because inevitably I will leave somebody out. But thanks to everybody who's been involved in making. There was a fair bit of planning, as you can imagine, went into this event, and I'm delighted that it has gone off well. Eraigling Lekela was a message I saw in the chat while Ciarán was speaking. And I think that's a great way for us to finish. Let's move forward together, and let's realize the potential that this funding opportunity provides us. So I look forward to interacting face to face, and no doubt virtually in the future. Gurv Míle Maithagh Galéir, and thank you for participating today, and good luck with our joint endeavors in the future. Take care.